This is Larry. Larry was admitted to the hospital last week. On Thursday, Dr. Smith prescribed diuretics to Larry to take while he was in the hospital. Linda, the pharmacist, filled the prescription, and Nancy, the nurse, administered the medication to Larry. Friday morning, Dr. Smith returned to check on Larry and see how he was doing. Larry knew that he had been labeled a fall risk and needed to ask for help to get out of bed. Larry was really starting to feel the effects of his medicine and asked the doctor if he could help him get to the bathroom. Dr. Smith tells Larry that he's on his way to meet with another patient, but will tell the nurse on his way to the next room. Dr. Smith passes Nurse Nancy at the nurse's station and quickly tells her that Larry needs to use the restroom. Before Nurse Nancy can reply that she's just going to finish up some paperwork, the doctor is gone. Nurse Nancy sees Carla, the CNA, walk by and asks her to help. Carla, the CNA, says that one of Larry's therapists should be on their way soon and that they can help when they get there. However, Carla, the CNA, didn't know that Olivia, the occupational therapist, was running late. Susie, the speech-language pathologist, happens to be passing by Larry's room. Larry hollers for help, but Susie knows that Larry needs a lot of help getting out of bed, and she'll need another person to help her. Susie tells him that she's going to find someone to help and will be right back. While Susie is looking for help, Larry decides to take matters into his own hands and attempts to get out of bed by himself. Before he makes it to the restroom, he falls. When the manager asks what happened, there was a lot of finger pointing about whose fault it was that Larry didn't get the help he needed and fell. Uh-oh, let's try that again, this time with teamwork and interprofessional communication in mind. This is Larry. Larry was admitted to the hospital last week. On Thursday, Dr. Smith prescribed diuretics to Larry to take while he was in the hospital. Linda, the pharmacist, filled the prescription, and Nancy, the nurse, administered the medication to Larry. Friday morning, Dr. Smith returned to check on Larry and see how he was doing. Larry knew that he had been labeled a fall risk and needed to ask for help to get out of bed. Larry was really starting to feel the effects of his medicine and asked the doctor if he could help him get to the bathroom. Dr. Smith asked Larry to press his call light to alert the nurse that he needed help, and told Larry that he would personally talk to the nurse at the nurse's station. Dr. Smith stops by the nurse's station to let Nurse Nancy know that Larry needs to use the restroom. Dr. Smith also communicated the urgency of Larry's request. Dr. Smith told Nurse Nancy that he was late to meet with another patient, but could help if she needed it. Nurse Nancy knows that she will need help getting Larry out of bed, but she also knows that Olivia, the occupational therapist, is scheduled to see Larry and should be on her way to his room. Since Nurse Nancy knows that Larry might try to get up on his own if someone isn't there fast enough, she quickly goes to Larry's room and calls Olivia, the occupational therapist, just to let her know that she needs her help when she gets to Larry's room. Olivia was just about to move Larry to later in the day due to another evaluation that was placed on her schedule, but quickly made her way to Larry's room to help Nurse Nancy. Together, Nurse Nancy and Olivia, the occupational therapist, get Larry safely to the restroom. In the first scenario, everyone talked at each other, but no one really stopped to see how they could help each other. This ultimately put Larry's care and his health in trouble. In the second scenario, the various professions demonstrated teamwork and interprofessional communication by letting the other professions know what was going on and keeping the line of communication open. This led to a safe and happy Larry. Larry says thanks